Hello, everyone. I am Melissa Wade in the Water from the Light 103.9, and thank you for joining us on social media on our YouTube page. And of course, we know that October is National Breast Cancer Awareness Month. And so we want to make sure that we highlight it as much as possible, sharing as much information as we can with those who may be affected and even those who may not, because 9 times out of 10, you probably know someone who either is or has been. Well, I had the privilege and the honor to meet such an extraordinary doctor last month during a breast cancer awareness event. And I asked her if she would come on with me, and she totally agreed because she shared so much information that blessed me and so many others that were there for that event. So, joining us today for National Breast Cancer Awareness Month is Dr. Lola Olajide. And I'm hoping I'm saying that right, Dr. Lola.
You were very close. Olajide.
Olajide. All
Yes.
right. Well, of course, we know that you are a part of UNC Rex Healthcare. You specialize in cancer and hematology and breast cancer, and you gave so much information during that event that we had with Sisters Network of the Triangle that I am just so ecstatic that you agreed to be a part of this today to just, share it with a lot of our light listeners who are hanging out with us right now. So thank you. Can you start off by just giving us a little bit of your background?
Well, I am a medical hematologist and oncologist. And as you said, I do work at Rex Hospital, which is affiliated with UNC. And I actually went to medical school in Nigeria, University of Ibadan in Nigeria, and came to the United States in 1999, where I then trained at the Medical College of Georgia in Augusta for my internal medicine residency and moved over to Chapel Hill and became a trained hematologist oncologist at the UNC School of Medicine. And I've been in Raleigh ever since, love the area, and I don't think I'm leaving. So,
Great.
but yeah, I do primarily treat breast cancer patients as well as general oncology patients and people with blood disorders, which is what hematology is a specialty of.
Oh, wonderful. Well, during that program, the event that we had, there were so many women there that were like, Dr. Lola is my doctor. I love her. I love her. And I'm like, yes, she is the one we need to have on to give us some more information. So, of course, as we start, we know that women of color, primarily Black women, are twice as likely to die, to be diagnosed and to die from breast cancer. Can you start off by telling us why is that statistic that way?
Yeah, the statistics are quite appalling and sad. And it is, in fact, true that African American women or people of African descent specifically do have a higher incidence of more aggressive types of breast cancer. The mortality rate or rate of dying from breast cancer is, in fact, higher, mainly in minority populations, but even more so in the African American population within the US demographics. There are many causes for that, and we don't really know and can't identify the specific factors that lead to higher aggressive types of breast cancer in Black women. But it ranges from socioeconomic factors. Minority populations often in the US tend to be in categories that have lower incomes, may have more stress in their lives from, a myriad of factors ranging from finances, lack of insurance, lack of access. And so for some people, it is just that lack of access, lack of getting into the doctor on time to get diagnosed, lack of getting adequate screening that can increase the likelihood of developing more advanced cancers. But even when you take those factors aside, it has been shown in multiple studies that Black women, even aside from all of the other potential disadvantages that we may have, histologically, meaning as you look under the microscope at the pathology of these cancers, do tend to have more aggressive types of disease. Now, there are, in fact, researchers looking into the genetics of why this may be going on. There's a fantastic breast surgeon out of Cornell University, Dr. Lisa Newman, who has done a lot of work in Africa and has gone to sub-Saharan West Africa and done some genetic testing, mainly in Ghanaian women and Nigerian women, and have found that there are, in fact, genetic changes in the blood of women from those subcontinent countries that have, in fact, been found in African American women in the US, obviously because of slave trade migration over the centuries. And we do find that some of those genetic changes appear to have been protective for those African women from getting a disease called malaria. But that protective benefit that we evolved to have over generations seems to, in some way, have an impact on increasing the potential formation of a type of breast cancer called triple negative breast cancer. Right. So that's just one of the very, very nuanced, findings that we are trying to determine how we can overcome. But again, it's a matter of just trying to make sure that with the availability of tools that we have here, that we make sure people are aware of what they can do to try to get diagnosed early. And when they do get diagnosed, to get the appropriate treatment that they deserve.
Now, you mentioned triple negative breast cancer. And when we were there at the event, it was the first time I had heard it. And you made me say, huh? What exactly is that? If a woman is diagnosed with that, does it really mean? Or is that like, a more aggressive breast cancer, so to speak?
Yeah, so breast cancer is not just one entity. There are many different types of breast cancer based on a lot of biological changes that we find on these cancer cells. Mm-hmm. And the most common designation of breast cancer is what people call estrogen positive breast cancer and estrogen negative breast cancer. But even within the grouping that is called estrogen positive or negative, there are additional markers that we find on these cancers that tell us how aggressively they may behave or what treatment options we have to manage them. So triple negative breast cancer is basically a breast cancer cell that does not have any evidence of estrogen or progesterone staining. Those are hormones that we normally will find in the breast tissue. And also does not have an overexpression or does not have an excessive amount of a type of protein called the HER2 protein. So the absence of those three factors, the estrogen, the progesterone, and the HER2, is what we call triple negative. And triple negative breast cancers are, in fact, more aggressive types of breast cancer. Mm-hmm. They usually require chemotherapy and now another kind of medication called immunotherapy to try to get them under control. It so happens that this more aggressive type of breast cancer is also more common in African American women compared to Caucasian populations. So again, not only do we have these more aggressive cancers predominantly showing up in Black women, we then have this cancer that is also, a little bit harder to detect sometimes and harder to diagnose and treat. So it does stack the disadvantage against the African American female population a little bit more than the Caucasian population.
Now, I know that when I go for my mammogram, they tell me that I have dense breast and that it is very, I guess, very much found in most African-American women. What is that? Because I was like, I have what? And what does that mean that we have denser breast tissue? And they asked me about the 3D mammography. Can you elaborate on all of that?
Yeah, it is really important for every woman who has begun having mammograms to know if she has dense breast tissue or not. And essentially what that means is the breasts are basically just made up of fatty tissue as well as glands or fibrous tissue. An easier way to describe that is milk ducts. In women who have breastfed a child, the milk is produced within those milk ducts and then comes out of the nipple. So within the breast, if you have a grouping of milk ducts and fatty tissue, but you happen to have a higher ratio of the milk ducts to the fatty tissue, it means that you have more density to your breasts. Conversely, in a much older person, maybe who's menopausal and has had multiple children, you may have more fatty tissue in the breast compared to the milk ducts. And this doesn't really have much to do with your weight as an individual overall. Okay. It so happens that African American women do have more dense tissue within the breast typically. And not all Black women have dense breasts, but in general, Black women are more likely to have denser breast tissue. How that's disadvantageous is because when you do a mammogram, often the mammograms are able to see much more clearly through fatty tissue. So if you have a lot more fat in the breast, you can actually see better if there are calcifications or masses or tumors within the breast. Whereas if you have lots of milk ducts and lots of the dense tissue, it looks very white on a mammogram screen, and cancers look white as well. So when you do a mammogram and you just see a big sea of white tissue, you're not sure if you're looking at the dense breast or if there's something underlying that. And so you can miss early tumors or very small tumors in a person with dense breast tissue. Now, the 3D mammogram is just a more technologically advanced type of mammogram that can actually do a little bit higher resolution and look through that density a little better and pick up things that may be hidden on a conventional mammogram. So really, for most women who have dense breast tissue, at the very minimum, should be getting a 3D mammogram, whether it's a screening if you've never had cancer or a diagnostic if you have in fact had cancer. And there's a step further, depending on the individual. Some women may need an ultrasound to further evaluate what's going on, or may need an MRI, but that does not apply to everyone. So that's essentially where the density is important, to know whether you need additional testing and to make sure that you're getting the right kind of testing for you.
Gotcha. Wonderful. So, as far as when to get started is having mammograms and how often we should get, I know it's been up in the air, different times, different places, different ages. What would you say is the age of which we should begin to get mammograms? And are there other, factors that may require us to get it done earlier or later or things like that?
So several years back, the U.S. Preventative Task Force put out a recommendation nationally that women should not necessarily have to start getting mammograms at age 40 and could wait till they were in their 50s if they didn't have very high risk family history and things of that nature. But what that generalization failed to kind of outline is that, again, Black women who are more likely to have aggressive types of breast cancer also are more likely to have triple negative breast cancer at younger ages than Caucasian women. So while it may be fine for a population of people that have later incidences of breast cancer and lower types of aggressive breast cancer to start their mammograms in their 50s, for African American women, I categorically recommend, and really, to be honest, for all women, I would recommend that we all start getting our mammograms at age 40. But again, specifically for Black women who are focused on today, because of that higher likelihood of developing earlier breast cancer, earlier ages of diagnosis, and at the younger ages, also the more aggressive type of breast cancer, age 40 really is the baseline that I would recommend. Now, in a person who has a strong family history of breast cancer, and we usually will determine that by your generation of family. So if a first generation family member, meaning your mom or your sister, and you've had multiple members like that with breast cancer at whatever age they've had it, you certainly should not wait beyond 10 years from the age that the youngest person in your family was diagnosed. So for example, if a person's mother was diagnosed at 45, then that individual probably should start getting mammograms in her late 30s, around 35 or and beyond, because you want to make sure the mammogram is really not preventing cancer. It's trying to catch cancer early. Right. So if you have a family history of a young age of diagnosis, you want to try to start your screening before you are at that age that you may be at higher risk.
Gotcha. Are all mammograms, well, I guess I can't necessarily say they're the same. Are there any differences that we should ask for, anything specific? Because of course we want to stress the importance of mammograms. And can you elaborate on that importance?
Again, mammograms are important because right now they are one of the best tools that we have. It's not a perfect tool by any means, but one of the best tools that we have to try to catch early diagnoses of breast cancer. And not just breast cancer, but there are also what we call precancerous lesions that are sometimes found. These are findings on biopsy that show cells that may in the future turn into breast cancer. But if they can be picked up early enough and removed, or in some cases people start on treatments that can lower the chance of those findings from turning into breast cancer, then it may in fact change the trajectory of a person's long-term health and outcome. So getting the mammograms at an appropriate time is important. Getting the right kind of mammogram, and that's usually, again, the technology being a 3D mammogram. For most insurance companies now, that is covered as a standard. I think there still are some plans where you may not be able to get a 3D without extra cost. But at least if you can get the additional cost, or if you can pay the additional copay to get the 3D portion, if you have dense breast tissue, I do think it is worth it. Now, in situations where a person has very dense breast tissue and for whatever reason may not necessarily have an insurance plan that would ordinarily cover a 3D, you can ask your physician to try to make an appeal so that you can try to have the appropriate test for you. And there are places that will also offer mammograms for women who are under insured or uninsured. And so looking into what resources are available through your community and your health centers are really important for that.
Sounds good. What should a woman who has been diagnosed, has just been told by the doctor, you have a breast cancer, what are some of the first steps, or what should they first do to make sure that they're heading in the right direction to get the best care?
Well, most people going through a cancer center should hopefully have access to what we call cancer navigators. In this case, it would be a breast cancer navigator. It's a very scary time when you get diagnosed with cancer, even if, we tell you it's an early stage or a non-aggressive cancer, it's still cancer. And so a lot of times that initial meeting with the physician, and from experience, I can, sit down and talk with the person for an hour, but it may just be the first few lines that they hear. And, we go back and forth to try to make sure that they assimilate all that information. But that initial visit is always scary. So I would say you need to get your team behind you. Your breast navigator with your cancer center will be able to help you navigate appointments and reach out to your doctors if you have questions and are having a hard time getting back and forth with that information. But also finding a good support group. And there are many in the area. And there are many support groups that are geared towards age or ethnicity or, different factors that may be important to you. But having a group that can help you emotionally and just to provide that, physical lifeline to be able to say, I've got a sister or brother or somebody else who's understanding what I'm going through that I can talk to is important. I will, however, stress that, again, we talked in the beginning about how breast cancers are very different. It's really key that the experience that somebody has had with their treatment and diagnosis, that you realize that that is not necessarily the same experience that you're going to have or the same outcome that you're going to have. Unfortunately, I have too many people who come in after a diagnosis and I talk to them about certain treatments and they say, well, I don't even want to hear about that, or I'm not going to take that because I know someone who used that drug or who took that medication and they didn't do well. Again, side effects are a reality of cancer therapy, but there are ways to manage them and not everybody has the same outcome. So getting a support team, whether it's your family, your friends, a support group, a navigator is important, asking questions, making sure you have access to your records so you can read through them and understand. And if you don't understand, ask questions. But, having that knowledge in front of you is really important.
Wonderful. So before I go to ask for any resources that you can provide or how we can get in contact with you, is there anything else that you would like to add for the women that are looking right now? Just, like I said before, you gave us, it was so many answered questions when you were talking. I was like, wow, I didn't know that. I didn't know that. Is there anything else that you would like to add that maybe women that are looking on right now, we should know just in general?
I do think that we should not forget about the preventative aspect. We've talked about early detection, which is where the mammograms come in and getting regular examinations. We've talked about diagnosis and treatment, but we don't want to just sit around and wait for this to happen, right? There are certain things that are beyond our control. We've talked about genetic changes that may be imminent or maybe a part of why some people get breast cancer. And I'll digress and just say that majority of breast cancers are actually not associated with any known genetic mutation. That's usually a very rare situation. But again, in terms of prevention, there are many risk factors for breast cancer, the first of which is just being female. But, making sure that we are aware that we know what the risk factors are and do things that we can to modify those so that we can live the healthiest life possible and hopefully never get cancer. But if we do, be as healthy as we can to be able to get through those treatments. So obesity is a major risk factor. Obesity is a major risk factor both for estrogen positive and even for estrogen negative breast cancer. Unfortunately, we've talked about how socioeconomic demographics and things like that can impact our community. Minority communities tend to have higher weight or what we call, or may just be overweight because, again, of the poor access we have to healthy, nutritious food, the poor access to, things that will allow us to be able to work through life without stress. You're having people working multiple jobs, you have lower incomes, and so you're caring for multiple family members. And so a lot of times women don't have time to take care of themselves. So again, making sure that you are aware that you know that nutrition is important, that obesity, independently of what you're eating, has a primary risk factor for not just breast cancer, but colon cancer and many other health diseases, heart diseases, that diabetes that impact minority communities. So with nutrition, it's important to make sure that you're eating lots and lots of vegetables. You want to be having a lot of fiber in your diet. High fiber diets do reduce the risk of many cancers, as do consumption of many vegetables. It's important to make sure that you know that having enough vitamin D supplementation, if you're vitamin D deficient, can reduce the risk of several cancers. Black people do have a higher risk of being vitamin D deficient because we have a natural protectant in our skin called melanin, which is what gives us the pigment. It keeps us from getting sunburn and a reduced risk of skin cancer. but also can reduce the availability of vitamin D in our system. So getting a vitamin D level checked, and if you're low, getting on some supplementation for that is helpful. Exercise is key, not just for the weight loss, but the regular activity and physical exercise actually has many potential health benefits and cancer reduction risks as well. Alcohol consumption can increase the risk of breast cancer, and generally people that are consuming more than one alcoholic beverage a day, long term do have a higher risk of developing breast cancer. Cutting out cigarette smoking if you smoke, it's just not good for anybody for anything. But those are some of the things that I would suggest that women start to pay attention to.
Those are great. That's great information. Fantastic. Risk factors. Absolutely. So, Dr. Lola, like I said, thank you so very much for coming on. You have shared so much great information in recognition of Breast Cancer Awareness Month. For those who are looking on right now, do you have any resources that maybe we can go online to find out more about what you have elaborated on today, or maybe even to find you? My hopes are that I have some women that are looking right now saying, wow, this is a doctor Melissa has highlighted, and I'm highlighting her for a reason. How do we get in touch with you? For those who may have had that tough talk to say, hey, look, you are positive and we need to move on from here.
Well, first of all, I pray that nobody needs a doctor like me. But if you do, I do work at UNC Rex Hospital, and that's where I am. I am deliberately not on social media, so you won't find me there. But in general, resources, that's another important point, is that you do have to make sure that when you are looking online, that you're looking at reliable resources, because
Absolutely.
Often there's a lot of information out there that may not really be reliable or relevant. So the American Cancer Society is a great website. Many of the breast cancer conferences that go on throughout the year, which are geared towards scientists and physicians, also provide access to lay people. And so the big breast cancer conference every year in December is the San Antonio Breast Cancer Conference. And that is one of the major places that myself and other medical oncologists get the latest information on what research and what new drugs have been approved or is on the pipeline. And so that's really a good place for people who are going through breast cancer to be able to get cutting edge information. You can also check the Miami Breast Cancer Conference, which happens usually in March every year. And similar thing, online, you can find access to what the newest data that has been presented at that conference is. But usually starting with your primary physician to find out which local oncology group you have access to is a good way to be able to find a good doctor in your community. But again, as I said, if you are in the Raleigh, North Carolina area, Chapel Hill, Rex Hospital, we have a great breast center. And, again, would hope that we didn't have to see you, but we would love to be a part of your care if that was needed.
Wonderful. Dr. Lola, thank you. Thank you so very much. God bless you. And just thank you for being a tool and an instrument and sharing all the knowledge that we need. It's not just this month, but all around for those who may be affected. And like you said, and giving us information of how we can better take care of ourselves that we may not even come up with the breast cancer. So thank you so very much for your information and your time.
Thank you. It's a privilege to be on The Light. I love your show as well.
Thank you. All right. Blessings to you. God bless.
Take care. Bye-bye.
All right. Y'all, thank you so very much for joining us. And of course, as we continue to recognize National Breast Cancer Awareness Month, we have an event that's happening on the 29th that we will be supporting our Sisters Network Triangle here in the area, and we want you to be a part of it. Check out our website for more information on that at thelightnc.com. Until next time, love you. God bless you. Grace and peace.